Suicide is an important, not very commonly talked about and misunderstood topic. Hi, I'm Dr. Angie. I'm a psychiatrist and I have decided to make this series on commonly misunderstood topic in psychiatry. After this video, I'm going to make a video on addiction. Please let me know in the comment section if you have any questions about this topic or my next topic, and I'm going to include it in my next video. I'm going to talk about 5 different types of suicidal ideations. Are there risk factors? What are the protective factors and treatment that is available out there? I'll share my personal experience as well as my professional experience in dealing with my clients who are going through suicidal ideations. So let's first start with 5 different types of suicidal ideations. Active suicidal ideations, in which a person has a desire to end their life. It can be associated with intent and or plan. So a person can just have a desire to end their life, but if suicidal ideation is more advanced, they develop intent when they want to carry out their desire and they start thinking about different plans on how to end their life. Active suicidal ideation is a mental health emergency and it's a crisis situation. When a person is going through active suicidal ideation, they need immediate help. So calling 911, calling ambulance or a suicide hotline. I'm going to talk about things that are going through someone's mind when they are thinking about suicide too. So even if a person is having active suicidal ideation, a lot of time they have ambivalence, which means that they want to do it, but a part of them doesn't want to do it and they are trying to reach out for help. So there's a common misconception even in medical community. If a person is sharing that they want to kill themselves or they want to end their life, they are just trying to do it for attention. And if a person wants to kill themselves, they are not going to tell other people. And that is not true. What happens is a part of them still want to live and they are trying to reach out for help. They are trying to reach out for support when they are open about their suicidal thoughts. So if a person share that with you, please take it as an emergency. Then there is passive suicidal ideations. Passive suicidal ideations are thoughts in which a person just doesn't want to live. They don't want to end their life, but they don't care if they live or die. Sometimes my patient even say that I wish that I get a terminal illness. Like people make these kind of wishes. They also wish that they just go to sleep and they don't wake up. They don't care if they die in a car accident. Also, they have very severe hopelessness. So they don't have an active desire, but they just don't care. And a lot of time when a person has passive suicidal ideation, I've heard from my patients and my clients that they say everyone has it and it's very normal. I just don't like that term normal because we all are normal, but we are unique in ways and we deal with different type of issues. So sometimes my patient asks me, don't you have those kind of thoughts? And I get asked that question multiple times. So my answer is that of course I don't know if everyone has it or not, but it is common or it is not uncommon to have those type of thoughts during one's lifetime. Even myself personally, I have those type of thoughts when I have felt really down and I have felt that there's no point in living and I don't care if I live or die. So I do feel that vast majority of people have felt that at certain point of their life, but to have those feelings chronically on a long-term basis, definitely it's not the way to live life, because if someone is having these kind of thoughts on a long-term basis, they are definitely suffering. And I'm going to discuss more about it later on. Third one is accidental suicides. This is very common too. So a lot of time and we don't know if it's an accident or not, but I have seen it. I know it is common because a lot of my patients, when they come after a suicide attempt, they tell me that it was accident and they didn't mean it. And a lot of time it is accidental overdose when they are just trying to calm down. If they have substance use issues, they are trying to do that drug and accidentally they end up doing too much and end up dying or end up needing serious medical help and it became a suicide attempt. So fourth one is intrusive suicidal thoughts. This is very different than suicidal ideation because intrusive thoughts are not something that a person wants to do. Like usually they don't have desire in committing suicide, but they have these intrusive thoughts that are more obsessive in nature. And the last one, which is not uncommon, is also non-suicidal self-injury. In this type of injurious thoughts or attempts or actions, usually the person hurt themselves, like they cut themselves. I've seen people like they burn themselves, they scratch themselves. So there are actions of self-harm, but their intent is not to hurt themselves. And a lot of time these patients tell me that, and it's very known in literature also, they have so much emotional and mental pain, but they can't see it. And once they actually injure themselves or hurt themselves and they see the blood or they see the burn, it gives them relief and it releases their emotional or mental pain. So they feel better. It becomes kind of very addictive also. It becomes very difficult for them to stop cutting or injuring themselves because it gives them relief. I also want to add that sometimes that non-suicidal self-injurious behavior become accidental suicides too. What are some of the traits and risk factors that are common in people with suicidal ideations? Aggression. So what is suicide? Suicide is aggression and violence towards oneself. So those people have aggressive tendencies. They also are impulsive. Also, the other traits that increase the risk for suicide are loneliness, alienation, and poor communication styles. And then there are lifestyle changes. For example, loss is a big one. Financial difficulties, loss of job, loss of relationship, loss of a child. Breakup and divorce is also a major loss that we see. So what happened? A lot of times, some people, when they are going through loss or difficult times during their life, they communicate with people who are close to them. They communicate effectively, and that's how they cope with their issues. But people who just can't communicate very well, they just keep everything inside, they are more prone to suicidal ideation. Substance abuse obviously impairs one's judgment and makes someone impulsive, and it increases suicidal risk too. Prior history of suicidal attempts, especially if they are lethal or serious attempts, family history of suicide, that increases one's risk. Now let's talk about protective factors. So having a strong support system. Actually, one thing I forgot to talk about in risk factor, anxiety, high anxiety, and of course mental disorders like depression, mood swings, schizophrenia can increase the risk too. So in the protective factors, having a good social network, having family, having dependent children, it protects someone from suicide because then they think that those people need them. And having a strong social network provides support. Having a strong cultural identity. If someone is religious, faith is actually a protective factor because a lot of faith don't think that a suicide is not the right thing to do. So a lot of times my patient tell me that they are not going to do it because it's not permitted by their faith. So it is a protective factor as well. Having a purpose or having future goals, those are all protective factors against suicide. So there have been times when I have felt that I'm really down and I'm just sinking down a hole and I can't come out. There's like darkness around me. Certain things I've learned that I've started doing and it has helped me so much. So I just want to share those things. First of all, when I'm having a really down and sad day, I've started to do is I have implemented letting go technique in my life. So I allow myself to feel those unpleasant emotions. A lot of time what happens is that a person doesn't allow themselves to feel those emotions, and that make their misery worse. Once you allow yourself to feel it without thinking too much about it, it's just like feel it without judging it, without trying to avoid it, without trying to stop it, your sad feelings will go down significantly. So it's just like permitting yourself to feel it without feeling bad about it. It's okay to feel sad. Let yourself feel sad when you are feeling sad without thinking too much about it. For me, since I started doing it, I've always noticed that my misery go down, and a lot of time I still stay sad that day, but I remind myself that it is what it is and nothing lasts in this life. Happiness doesn't last, sadness doesn't last. this is the universal law that things come and go. I just remind myself that it's not permanent, it's not going to last. And when I wake up next day, I always wake up very refreshed, grateful, and lighter. Other things that I have done to prevent those sad moods or to prevent those really down feelings are I've implemented regular meditation in my lifestyle. I call meditation like free therapy. There's now research that has shown it to be so effective also for sadness and depression and to improve one's quality of life. And also I've implemented workouts, so you can do any kind of workout, just move your body. All those suppressed emotion help us release them. So I want to add, there are a lot of other promising research being done, like we have psychedelics, that is, we have so much research going on psychedelics for treatment of depression and mood disorders. Also we have research going on genetics. So hopefully in future we have some more promising treatment, because currently we don't have a lot of really good treatment for mental health disorders, unfortunately. I hope this video was helpful, and please let me know in the comment section if you have any questions. Also, I request, if you like this video, like, subscribe, comment, and share. It helps my channel a lot, and it will keep me motivated to make more videos like this for you in future. Thanks for watching. I'll see you next time.